Hello,
Hi.
I'm Robin. I'm a
Hi.
nursing student with
Hi.
Muskegon Community College.
Okay.
Can I get your name and date of birth?
Casey Van Huysen, 21795.
How are you doing today, Casey?
I'm doing okay. How are you?
Good. I'm just going to go over a few questions with you about your health.
Mm-hmm.
So just answer them to the best of your ability.
Okay.
What brought you in today, Casey?
Just a routine follow-up.
Okay. Do you have any health concerns today?
I don't think so.
Okay. All right, since you have no health concerns today, I'm going to go over just some basic questions. So you
Okay.
can either answer yes or no,
Mhm.
or if it's never happened to you,
Mhm.
just, let me know that as well.
Okay.
Have you ever had any communicable diseases?
No.
Okay. What immunizations have you had?
I think I've had all the ones that are necessary.
Okay. Have you had a pneumonia shot?
Not to my knowledge.
Okay. What about an influenza?
Previously, yes. I have not gotten one this year or the previous year.
Okay. And why is that?
Because I've gotten body aches and fever about 30 minutes after receiving the shot.
Okay. Do you have any allergies to any medications right now?
I think just Ambien.
Okay, and what's the reaction to that?
Hallucinations.
Okay. Can you explain some of those hallucinations?
I felt like I was on a boat when I was laying in my bed,
Okay.
and got like seasickness.
Okay.
And I was seeing people that were definitely not there.
Okay.
Yeah. So I avoid that drug.
Okay.
Mhm.
Yep. What current medications do you take on a regular basis?
I really don't take anything.
Okay. Do you take any over-the-counter medications, ibuprofen, any type of...
I dabble with ibuprofen from time to time, usually
Okay.
during like the menstruation time.
Okay.
But other than that, no.
Any type of supplements or
No.
oils or anything like that?
Nope.
Okay. So you have no questions about any medication then?
No.
Okay. Are you a smoker, Casey?
No.
Okay. Do you drink caffeine?
Yeah, maybe like 1 cup a day.
Okay. And what type of caffeine?
Coffee.
All right.
Mhm.
Do you drink alcohol?
Yeah, very seldom, maybe like once or twice a month, if that, and it's usually like a glass of wine.
Okay. Do you use any other substances such as cocaine, speed, or marijuana?
No.
Okay. Okay, and the next set of questions I'm going to ask you is more about your food and healthy lifestyle.
Okay.
Do you have any food allergies?
Not to my knowledge.
Okay. So you've never had a reaction to any type of food?
No. I think sometimes celery makes my mouth numb,
Okay.
but that's it.
All right. Do you have any surgery history?
I had my tonsils removed in like 2009 or 2008, if
Okay.
that's relevant.
Okay.
And I had my lingual tonsils removed in 2015, I believe.
Okay. And what was the purpose for the tonsillectomy?
So the tonsils, they were just really, really large.
Mhm.
I never got strep throat, I had strep throat one time.
Okay.
But I think they were large and they took them out. And then the lingual tonsils, I had those removed because I was actually having a difficult time swallowing.
Because they were so big.
So
Yep.
so enlarged.
Okay. Have you ever had to stay in the hospital overnight?
Yes, for my lingual tonsillectomy.
In 2015?
Correct.
Okay.
Because I have, I do not wake up from anesthesia. What should take only 2 hours in recovery, I'm there for 8-9 hours.
Okay.
Yeah.
Have you ever been in an accident or had any trauma?
No, ma'am.
No? Okay, this is more about the history of your family.
Okay.
Has anyone in your family ever had heart disease?
Not to my knowledge. I know my mom has high blood pressure.
Okay.
But I believe that's it. No
Okay.
cancer or stroke.
No stroke or
Mm-mm.
diabetes?
No, my mom is borderline for diabetes, but as long as she's diet controlled,
Okay.
she's good.
Okay.
Yeah.
And no cancer, you said,
No.
correct?
Mm-mm.
Okay. Have you ever had a history of breathing problems?
I think I might have like cold-induced asthma.
Okay.
That's what my doctor kind of had labeled me as.
Okay.
So,
And
yeah,
what
I mean-
symptoms do you normally have with that?
I'll get like heavy chest, the wet, barky, productive cough, with some like shortness of breath.
Okay. And no inhaler for that, correct?
I do have an albuterol inhaler,
Okay.
or a ProAir inhaler that
Okay.
I will use very seldom during those
Okay.
times. Yeah.
Okay. When was your last TB test?
2015, somewhere around there.
Okay. And what was the result of that?
My TB test came back positive. I did have a chest X-ray though, and that did come back negative.
Okay. So when was your last chest X-ray?
I think that was in 2015 also.
Okay.
It was right around that same exact time.
So every year that you're due for a TB, they just recommend that you get the chest X-ray?
Correct. Yep.
Okay. Do you have a history of lung disease, such as asthma, pneumonia, or lung surgery, besides the cold-induced asthma?
Mm-mm. No.
Okay. What is your usual daily activity and exercise routine look like?
Well, I go to school almost every day. I do work 2 jobs, and I'm on my feet.
Okay.
Majority of my job, and then I really do try to get at least 30 minutes of exercise in a day. Most days, probably about 6 times a week.
Okay. And how is your exercise tolerance? Is it good, fair, or poor?
I would like to think it's good.
Yes.
Yeah.
All right. Do you ever get chest pain or heart palpitations during exercise?
Mm-mm.
Okay. Any dizziness?
No.
Do you have a history of high blood pressure, leg pains, cramping when walking?
No.
Okay. Do you have a history of heart disease, heart attack, or heart surgery?
No.
Okay. I'm just going to ask you about what you eat in a 24-hour
Okay.
span.
Okay.
So what does your normal breakfast look like a day?
So typically I have about 1 egg white,
Okay.
and then I have like an English muffin with, I usually do like a teaspoon or like a tablespoon of salsa on the English muffin with my egg white with my cup of salsa, or my cup of coffee.
Okay. And what does your lunch look like?
Well, I eat a lot of fish. I'm not a big meat eater, so I do eat a lot of fish. I usually have some fish and some, like a salad, and maybe some fruit,
Okay.
usually.
And how about a normal dinner?
Well, it depends on the day. If I make extra food, sometimes I'll have my leftover fish for dinner. Otherwise, I may have like some spaghetti squash and pasta sauce with like a piece of garlic toast.
Okay. And what about a snack in between any of those meals?
I really like yogurt, so
Okay.
sometimes I'll have a yogurt, or I'll have some like a variety of nuts, like pistachios or almonds or something.
And who prepares the food?
Me.
Okay. Have you recently gained or lost any weight?
Mm-mm.
Okay. Are you satisfied with your weight?
Yeah.
Okay. Has your appetite changed in the last month?
No.
Do you have excessive thirst?
No, I don't think so.
Okay.
Mm-mm.
And how much water do you intake a day?
Probably about 96 ounces
Okay.
a day.
And then I'm going to explain a little bit here what this is.
Mhm.
This is the My Plate diagram.
Mhm.
So this is the portions of each one of these you should be consuming a day.
Okay.
So what would your plate look like?
So I, like I said, I really don't eat a ton of meat. So when I make a meal, I think my plate would mostly consume vegetables.
Okay.
And protein. So my protein and vegetables probably about the same, and then the rest of it would be grains.
Okay.
I don't tend to eat a lot of fruit with all my meals. I do get some fruit in with a snack.
Okay.
And dairy, I don't consume usually like milk with my meal.
Okay.
Okay.
Any cheese, yogurt?
No, I
Okay.
will have like a yogurt for a snack, but I don't usually eat any type of cheese with
Okay.
my dinners.
Okay.
Usually.
All right, Casey. Do you have any dental problems?
No.
Okay. What was the date of your last dental exam?
August, I think, of last year.
Okay. And what does your daily dental hygiene look like?
Well, I brush my teeth twice a day. I floss before I brush in the morning and at night.
Okay. Have you ever had a history of gallbladder disease or diabetes?
No.
Okay. Have you ever had difficulty eating?
Well, I had the difficulty swallowing before I had my lingual tonsils removed, but since then, no.
Before they were removed, was it ever hard to eat, or
Yeah.
besides just swallowing,
Yeah,
was your
I would-
appetite poor?
I think I ate less
Okay.
because I had trouble swallowing.
Okay.
But it's been much better since
They were
I have.
removed.
Yes, correct.
Okay. Any problems or recent changes in your bowel pattern?
No.
Do you have any abdominal pain?
No.
When was your last bowel movement?
This morning.
Okay. And usual frequency?
Usually twice a day.
Okay. Color and consistency of the bowel movement?
Formed?
Okay. Do you ever have diarrhea or constipation?
Not usually.
Okay. Any problems or recent changes in your urination pattern?
No.
Burning pain or hesitancy?
Mm-mm.
Okay. History of urinary tract infection?
I think I may have had one.
Okay. Any difficulty holding in your urine?
Sometimes. Okay.
So explain a situation.
So, like, if I get excited,
Mhm.
sometimes I feel like I have to go to the bathroom right now.
Okay.
I have done, like, bladder training exercises where I will empty my bladder and then go do something for, like, an hour and then go to the bathroom again, or try to, even if I don't have to go. And
Okay.
that's has seemed to help.
Okay. Great. Is there any blood in your urine ever?
No.
Okay. Do you empty your bladder completely every time you go?
I try to, yes.
Okay. Have you ever had any hair loss?
No.
Have you ever had dry scalp, dandruff, or scalp lesions?
No.
Okay. Dry brittle nails?
Nope.
Skin dryness, itching, sores, or color changes?
No.
Okay. Skin products used?
I use a lot of Vaseline or Eucerin because it's non-perfumed, and I feel like that moisturizes my skin a little bit better than something with perfume.
Okay. Do you use sunscreen?
Yes.
Okay. Are you currently experiencing any pain?
No.
If you are in any pain
Mhm.
ever, what do you do to relieve your pain?
Usually some ibuprofen.
Okay. How many hours a night would you say you sleep?
Probably like 6 to 7
Okay.
on average.
Do you ever take naps during the day?
No.
Okay. Do you ever have difficulty falling asleep at night?
No.
Okay. How about difficulty staying asleep?
Not usually.
Okay.
Mm-mm.
Do you ever use any sleep aids or meds to go to sleep?
Mm-mm. Except for that Ambien the one time, and it made me see stuff that wasn't there.
Mhm.
So no.
Okay. Specific limitations with mobility.
No.
Okay.
Mm-mm.
Do you have any history of arthritis, backache, swelling of joints, or muscle weakness?
No.
Okay. Do you wear glasses or contacts?
I wear glasses for long distance. Yeah.
When was your last eye exam?
September or October of last year.
Okay.
Okay.
How long have you been wearing glasses and contacts for?
I think I've worn glasses for probably the last 6 years.
Okay. And have you had any vision changes in the last year?
Yeah, my last eye appointment in September, October, they said that my vision had gotten a little bit worse.
Okay. Have you ever had a history of cataracts or glaucoma?
No.
Okay. When was your last hearing exam?
That I don't know. I think it's been quite a while since I've had a hearing test done.
Okay. Do you wear hearing aids or have you ever experienced hearing loss?
No.
Okay. Do you have frequent ear infections or tinnitus?
No.
Okay. Have you ever had changes in taste or smell?
No.
Okay.
Mm-mm.
Have you ever had changes in sensation or numbness?
No.
Okay. Have you ever experienced dizziness or blackouts?
Not to my knowledge. No.
Okay. Ever have a seizure?
No.
Okay.
Mm-mm.
Have you ever experienced memory changes?
No.
Okay, these are a little bit more personal questions, so
Okay.
just let me know if you feel uncomfortable
Okay.
answering any of them. When was your first day of your last menstrual period?
So we are in January, so that would be like the last week of December.
Okay. And you are not currently in menopause, correct?
No.
Okay. Have you ever had difficulty with menstruation?
No.
Okay. When was your last pap smear?
December of 18.
Okay. And what were the results of that?
Normal.
How many children do you have?
I currently don't have any.
Have you ever performed a self-breast exam?
No.
Okay. Have you ever noticed any lumps, tenderness, or discharge from the breast?
No.
Okay. Do you ever experience any vaginal discharge or sores?
No.
Are you currently on any contraception?
No. I previously took birth control, but I actually just recently discontinued it.
Okay. Okay, this next section is going to go over your well-being.
Okay.
And once again, if anything feels uncomfortable, just let me know.
Okay.
Who is your support system or significant other?
It would be my husband.
Okay.
My family and friends are really great. My coworkers.
Okay.
Everybody's really great.
Who do you live with currently?
My spouse.
Okay. Are you satisfied with the living arrangements?
Mm-hmm. Yeah.
What is your home environment like?
It's usually pretty calm.
Okay.
Quiet. Cozy.
Okay.
Yeah.
And you feel safe where you're at?
Yeah.
Okay.
Correct.
How many pets do you have?
We have 2 dogs.
Okay. What are your most important health goals?
Keep my heart healthy and my mind healthy.
Okay.
Mm-hmm.
What do you do to be healthy on a daily basis?
Well, I try to eat healthy, and I try to exercise, get daily activity in as much as possible, and I try to do like mind exercises, like meditation and yoga to help keep me mentally and physically centered.
Okay. What is the highest education or grade you have completed?
I went to a trade school, and I graduated with my MA certificate, and that's what I do now. I
Okay.
work as an MA.
And you enjoy that?
For the time being,
Okay.
yeah.
Are you satisfied with your career?
I'm content right now. I'm currently a nursing student, so that is going to be very exciting and very enjoyable when I'm done.
Okay. Have you experienced any major life changes in the past year?
We bought a house in July of this past year, and we got married in September. So
Okay. Exciting.
yeah. So we've been really busy.
Okay. Do you have any current stress, fears, or concerns at the moment?
Just juggling work and school, making sure I dedicate enough time to both.
Okay.
Yeah.
What are your usual methods of coping with that stress?
So, like I said, I do exercise to help get my mind off of school and to maybe release some physical stress. And then I do, like, I'll sit in a quiet room and I'll have a candle going or some soft musical instrumentals when I do yoga.
Okay. Have you ever had a history of depression, mood swings, or anxiety?
Mm-mm.
Okay. What are some of your religious practices?
So when I am very frustrated and I can't seem to find a way out with my friends or family, or just like to kind of deal with things on my own that's not physical activity, sometimes I'll pray, and that sometimes makes me feel a little bit better.
Okay.
So,
Do you feel like you have control over the future?
somewhat. I mean, I think we kind of always have control to some degree. So yeah, I think somewhat. Control, at least some control over my own future.
Okay. What health beliefs will impact your health care at this time?
I think maybe like always increasing your amount of exercise or maintaining a certain amount of daily activity or exercise. I think that's always good to maybe, good for your health beliefs and impact on your health.
Okay. A nurse says, I will be right back with your pain medication. How much time will you allow before calling the nurse's station?
I think that would probably depend on the situation or how much pain I'm in.
Okay.
But usually, I mean, I would probably say like 30 minutes to a half an hour.
Okay.
Or 30 minutes to an hour.
Okay. Who makes healthcare decisions for you or in your family?
Myself. Yeah.
Okay. Over what areas of your healthcare do you feel you have control over?
I mean, all of them.
Okay.
Maybe.
What foods do you normally eat when you are feeling ill?
I try to increase my amount of vitamin C and fruits. And then I'll eat some like egg whites because it's soft and it's protein.
Okay. Who do you need close by while you are ill?
I like to have my spouse there.
Okay.
Usually.
How do you prefer health-related teaching and inform be presented to you?
I really like things physically demonstrated
Okay.
to me. I'm a visual learner, so seeing it actually demonstrated is really helpful.
Okay. And now, Casey, we're wrapping up things here, but is there anything else that you would like to add that we have not identified?
Not that I can think of.
Okay. So, Casey, I'm just going to recap kind of what we went
Okay.
over. So, overall, you're here for a routine follow-up.
Correct.
You have no other health concerns today that you want to bring up?
No.
No? Okay. You do have an allergy to Ambien, and you experience hallucinations with
Correct.
that. You are currently on no medications,
Right.
correct?
Yes.
Okay. You do consume caffeine, about 1 cup a day of coffee.
Correct.
You drink alcohol about 1 to 2 glasses a month, and
Correct.
usually wine.
Yep.
Okay. You have no food allergies.
Correct.
You've had a tonsillectomy and a lingual tonsillectomy.
Correct.
And the only time you stayed overnight in a hospital was during the lingual tonsillectomy.
Correct.
And that was because of anesthesia, correct?
Correct.
Okay. The only time you've ever had a history with breathing problems is you have cold-induced asthma.
Correct.
Okay. Your daily activity for exercise is working out
Correct.
up to 6 days a week.
Yes.
Okay. You've experienced no weight gain or loss, no appetite change.
Correct.
Okay. Your bowels are normal.
Correct.
You wore glasses,
Mhm.
contacts.
Correct.
Okay. No difficulty falling asleep.
Mm-mm.
Overall, very healthy.
Correct.
Okay. And overall, your well-being is, you would say, good and good
Mhm.
condition. Okay.
Yep.
Yep.
I would say so.
All right. Okay. And then I will go over the objective part. The client appears open and clear. The patient responded to touch. She accepts it. She doesn't withdraw or pull away. Some other verbal communication was smiling, her voice tone, the eye contact. And the distance that she was comfortable was 18 inches to 3 feet.